There are a rare few in every generation whose work impacts not only their own industry, but it impacts the larger society. Our guest, he is redefining how technology interacts with patient care. Dr. Harsh Mahajan, a Padma Shri awardee and the founder of Mahajan Imaging. When I was researching you, your website prominently says your title as Chief Radiologist, which represents the title of a clinical leader, not director or chairman, something which denotes ownership. How do you manage to meet patients every day? What motivates you?
You don't need motivation. The easiest work for a doctor is in his own field. So for me, the easiest thing to do is radiology. You enjoy making that rare diagnosis. You enjoy talking to someone and alleviating the tension, the stress that a patient may have when you tell him all is normal. And that also gives a lot of satisfaction to any doctor, to any person. And that's why, though, I've been forced now to change the title from Chief Radiologist to Chairman.
At what point did you realize you are going to become an incredibly good radiologist?
I don't think I'm an incredibly good radiologist. Going higher up in life for success is not related to what you may have done. And that's been very true in my case. This was a fellowship in MRI. This gave me an opportunity to be in technologically most advanced field of medicine. The real beginning. So these were the early days and it was very, very exciting. Somehow between my wife and I, we felt that if we stay more than a year,
You won't be able to come back?
then we won't be able to come back. But I felt that I'm the only trained MRI person in the country. I'm going to forget everything. So दिमाग में आया कि अपना करना चाहिए. To think, मतलब X-ray ultrasound लगाना ही बहुत बड़ी बात थी. Here we are talking about MRI. And there's only one MRI as yet installed in the country. My father was principal in Hansraj Model School. So he talked to some of the parents. He spoke to them and one of them became ready.
And it was a very high capex thing.
Oh yes. It was 2.5 crores at that time.
Those days.
And we have to get a loan. Loan kaun dega? So we went to ICICI. Mr. Wagul was the chairman of ICICI Bank at that time. And by the end of it, he says, young man, I'm convinced we will give you the loan. This was a green light that we got. So if you say that, we did great and we achieved so much and this is what we did and this is how it happened and मैं tiger हूँ, मैंने ही सब कर लिया, ऐसा कुछ नहीं होता. You talk to most people and you talk to the biggest of businessmen. There will be incidents in life which something went wrong. That is what, when you look back 10 years later, that is what went right.
How does the holding company and various segments within the company look like?
In the year 99, we formed this company, Mahajan Imaging Private Limited, under which our current centers run. We run 11 centers. 6 of our centers are standalone. Private hospitals. We are in Gangaram Hospital since 25 years. We are in Fortis Hospital at Vasant Kunj since 18 years. And we are in PSRI Hospital, running the radiology there since 8 years. We are also running a public-private partnership in Safdarjung Hospital, in the Sports Injury Center since 14 years. So really, if you ask me, we straddle the entire healthcare delivery ecosystem with standalone diagnostics within private hospitals and diagnostics within public hospitals.
I also wanted to talk about the new initiatives that you are incubating, the AI stack which is going to make these machines smarter.
We started working with researchers and developers across the world and in India, helping them make AI algorithms. That's how we got into AI, which is called CARING, Center for Advanced Research in Imaging, Neurosciences and Genomics. Very good about it. There are hundreds of developers making AI algorithms, hundreds being developed, nothing being used in clinical practice. So that's when Vidur actually decided that let us become the middle layer. To take AI from the bench to the clinic, it became a separate entity called Kapul.ai, built in India for the world.
What are some other new ideas that you are incubating as a part of Caring, sir?
Caring on its part is into a lot of pure research, a lot of applied research. We work with IIT, we work with Bologna Institute, we work with Max Planck Institute in Europe, we work with MIT out of Cambridge, and they are using this data for something which I think humanity at large is going to benefit in many, many ways.